welcome to You Diaries. India is facing epidemic in diabetes. Today, 67 million people are diabetic and around 70 million people are in pre-diabetic stage. Today we have Dr.Johny Kannampilly, a leading diabetologist in Lakeshore Hospital with us. Welcome, Doctor. Doctor, can you explain the complications of diabetes, please?
Diabetes is affecting lots of people today. The numbers are increasing alarmingly. It is coming even to younger people. Younger people like 20, 30, 40 are getting diabetes. It's a very dangerous situation what we are facing. It is coming like a tsunami to every homes in our country and our state. We have to be very careful of this. Now the issue is not just about diabetes. The issue is mainly of the complications it creates for diabetes, by the diabetes. Now, previously, diabetes used to come at the age of 65s and 70s, and that was reasonably okay because the complications of diabetes used to take about 10 to 15 years. And if you get diabetes at the age of 60, you get complication only by the age of 70 or 75, and it didn't really matter to the patient or to the family by any way because you are already in your old age. But think about the same scenario which is happening at a younger age. People getting diabetes at 20, 30 and 40. Your complications take only 15 years and it is very, very dangerous. It is coming like an atom bomb or a tsunami to our country, to our state, to the families, and we have to all be alert of this major catastrophe which is going to happen to our country. What are the complications of diabetes? It can affect every single major organ of your body. The whole functioning of the body can get affected. It can affect it straight from the head to the toe. It can affect your eyes and suddenly you can get bleeding into the eyes and you can lose your vision. It can affect your heart, causing heart attacks. It is known diabetic patients are 3 times at a higher risk than a normal person in getting heart attacks. You can get heart failures in a diabetic patient, and it is because the pumping of the heart becomes affected and you can get breathlessness and difficulty in walking and so on and so forth. It can also affect the kidneys and cause severe problems to the kidney, finally leading to kidney failures, needing dialysis and needing kidney transplant. Now all these complications are major health burden to just the individual, not only to the individual but also to the family members. It's going to cost a huge to treat these complications. A simple dialysis costs about 30,000 rupees per month, and it's an ongoing process lifelong once you start getting this complication of diabetes. It can affect the legs by neuropathy and arterial problems of the leg, causing amputations to the leg. You can get amputation at an early age. Now even treating a diabetic foot problem can be very, very expensive. It can affect every single blood vessel of the body. It can affect all the nerves of the body and can cause problems throughout the body. Now these sort of complications were not there about 20, 30 years back. The reason is, as I stated before, diabetes used to come at an older age. But today, because of our wrong lifestyles, which the youth is now following, we are trying to follow or mimic the westernization, going by all the processed foods and packaged foods. More consumption of that with lesser and lesser activities. We are getting into the so-called metabolic syndrome. The metabolism of our body is getting affected, and slowly we get into complications. Slowly we start getting obesity, we start getting diabetes, we start getting cholesterol problems and also hypertension. Now these are all now considered one disease of the same problem, that is the metabolic problem, or otherwise called the metabolic syndrome. Now we have to tackle this. We have to concentrate on controlling all these factors to control this dreaded problem of diabetes, that is these complications. It can affect even the sexual health of a person. even it can be for the lady or for the man, it can affect the sexual health of the person. Many people are shy to even tell to the doctors. So it is an important problem which can cause in a diabetic patient.
Doctor, we have a query.
Hello, I am Jayaram from SGT SUN Nilchima. I have a doubt for you. What lab test or examination do I need to get on a regular basis to lower my risk of diabetic complications?
So my dear friends, we have to be very much worried and be conscious of the complications of diabetes, which is dreaded, which is costly, and which can harm the whole person, the family and others. So we have to always be at regular checkups to make sure we don't land up in complications. From researchers, now we know that diabetes has a peculiar function which is called the legacy effect or the memory effect, which means that if your first 15 years of diabetic control is not good, it will create a bad memory in the cells of the body of each organ and cause definitive complications in your body. So we have the first 15 years of diabetes is very important period in your life. At that time many people take it very lightly and don't control your diabetes well. But now studies have shown if you get diabetes at a younger age, you should make sure that your diabetes control is very well. So for that, there are 3 things which every diabetic patient has to be looked into, and that is the ABC of diabetes. A means HbA1c. That's a new test which has come in the treatment of diabetes. HbA1c is now available in most of the good labs, and if you do an HbA1c, it gives us the average of the blood sugars in your blood system. If it is below 7, then you can say your treatment is going right and you are less chances of getting into complications. If you are a very young person, say you are below 40s, then it is even better if you can keep your HbA1c below 6.5. For a normal person who does not have diabetes, it is below 5.7. So it is even better if you can keep your HbA1c below 6.5. Now if you are a middle-aged person, you can keep that HbA1c test result at around 7. And if you are an old person, you can be little lenient and keep it around 8. Now this is a very important test to make sure that you don't land up in complications after 10 to 15 years of your diabetes. The second is the B, that is the blood pressure. Now you have to make sure your blood pressure is always under control, and it should be kept around 140/80 at least. Now if you can keep it little more lower, around 130/80, then it is even more better. Now you may have to take medicines to control it if needed, that your doctor will be able to advise you. The next thing is the cholesterol. A lot of people still think and do only just the cholesterol, but that is not enough. We have to do a lipid profile. A lipid profile is a combination of various tests of cholesterol, that is cholesterol, the LDL cholesterol, the HDL cholesterol and various others, triglyceride and others. Now the bad cholesterol is the LDL cholesterol. You have to make sure this LDL cholesterol is kept below 130 in a normal person, below 100 in a diabetic person, and below 70 in a person who has a family history of heart disease, or if you have chances of heart disease. So that is the important thing. Then you have another component called the non-HDL cholesterol, that is the cholesterol minus the HDL, and it should be kept below 130. So your doctor will be able to tell you which medicine to take and how much to take. Now a lot of people are worried about taking these cholesterol medications. Don't be worried. Now studies have clearly shown that this cholesterol medicine is one of the life-saving medicines in any individual. A lot of people think still cholesterol, I will manage with my diet alone. It is not possible in today's scenario many a times to control with just your diet. And it is always better that you take a cholesterol medicine. Now, there are a number of angioplasties and bypass surgeries happening in our state and in our country. In crores the cost comes for the whole cost of angioplasties in the state. Now it is a very expensive treatment, and also it is a very dangerous complication of diabetes. So taking a cholesterol tablet is always wiser and safer, and don't worry, it doesn't cause any complications or problems to the liver if you are advised and given by the right doctor, the right diabetes specialist. Now after these 3 tests, these are the basic tests, you have to keep it under control. You have to also make sure your weight does not increase. You have to have a proper diet and exercise and make sure your weight also does not go up. So always regularly check your weight and make sure that weight also does not go up. After this, then depending on various complications of diabetes, we have various tests for this. Like if you take a heart, once in a year, it is better to do a treadmill test. If you do a treadmill test and it is positive, we can always prevent heart attacks. As I said in my previous talk, that if you take a cholesterol tablet itself, you can prevent many of these heart attacks happening in the state. And again, after heart, you have the kidneys. If you are finding frothy urine, that means froth is coming when you are passing urine, that shows that you may be having slight affection in your kidney and protein may be leaking in your kidney. To find out that, there are few tests which can be done, that is called the microalbumin in urine. And if you do that, your doctor will be able to tell you whether it is gone abnormal and you need to take some medications for that. Now the importance is, if you can detect these complications at an early stage, we can prevent them from worsening and also prevent them from getting into worse complications of diabetes.
Doctor, we have another question.
Hi, I'm Adira from Saraswati Vidyaniketan, Nochima. I have a doubt for you. My question is, how will I know if the medicines that I take for diabetes are working?
How do I know my medicines are working? Yes, that's a very important point. The first and most important thing is whether your HbA1c is under control. As I said previously, our HbA1c in a young person with diabetes should be kept below 7 or 6.5, and that's the best control. So always do an HbA1c every 3 months if possible, and make sure it is below 6.5. If your HbA1c is not controlled, or if it is above 7, that means your medication is not working or your treatment is not going correct, and you need to go to your doctor and correct it. Secondly, your BP should be under control. As I said, it should be around 140 to 80 or even 130 by 80. It should be under control. The third is your cholesterol, with your blood tests. And also these all should be done every periodically by 3 months, and make sure your pressures, your cholesterols, your diabetes is under control. And the medications are needed for all this. And lastly, you should also not have hypoglycemias. People get hypoglycemia, that means the sugar is dropping and you are getting difficulty in doing your normal work. So it is very important that your medicines don't cause you hypoglycemias. So you have to go to your doctor if you are getting that and correct your medicines. Also, your weight should not go up. If you are taking medicine and your weight is going up, or you are getting increased appetite and you are wanting to eat more and more, that also means there is some problem with your medicines, and you need to go to a diabetes specialist and correct those medicines so that your sugars are controlled, your pressures are controlled, your cholesterols are controlled, you don't have hypoglycemias, you don't have eating problems, and you don't have weight gain. If all these are taken care, then you know that your treatment is going fine and you will not get into complications.
Doctor, we have another question.
Hi, I am Kavita from SDTSVN Nochima. I have a doubt. What is diabetic heart attack?
Yes, diabetes heart attack is becoming a major problem in our society. We have lots and lots of people getting into heart attacks. In fact, we should know that. Few things. One is, in a diabetic patient, you are 3 times at a higher risk of getting a heart attack. Secondly, even before you get diabetes, you are in a stage of pre-diabetes, and during that period also, you can get heart attacks. And thirdly, you can get silent heart attacks. That means you may not get the real symptoms of a heart attack, and you can get a heart attack. The usual symptoms are pain in the left hand. You can get the chest discomfort while climbing or doing some things, or you can get the jaw pain. These are all symptoms saying that you are going into heart attacks. You can get sudden sweating, discomfort, and that is a heart attack, and it is very dangerous, and you should immediately take medical help. You should not wait. Any small symptoms which you think it is not correct, it's better to take a medical help. Secondly, we should all try to prevent this heart attack, and that is what I said. You should check your cholesterol always from the age of 20 or 30. If you are obese, your food habits are unhealthy, and that it is better to do your cholesterol test, the lipid profile test, and control it with diet and exercise, and also add cholesterol lowering medications like statins, so that your risk of heart attacks can be prevented. 80 to 90% of the present heart attacks can be prevented with these measures.
Doctor, there's another question.
Hi, I am Yadu. I have a question to ask you. What is angina and how is it different from heart attack?
Yeah, angina and heart attack, what is the difference? It's very simple. Angina means you're getting the pain of the attack, but you have not got the attack. So that's the right time to immediately go and take the advice of a doctor and immediately get the help. You can get pain here, as I said, you can get a jaw pain, you can get pain here, or difficulty, suffocation. All these are signs of an angina. But a heart attack means the block has suddenly closed and it has caused death to the muscles of the heart. And that is a heart attack. So heart attack, all these can be detected by blood test and ECG test. You will know whether you are getting heart attack or even angina. So any small symptoms of this, it is better to go to the doctor immediately and take the help. Secondly, sometimes you may not get the typical features in older diabetic patients, and that is called the silent angina. Silent angina is you really not getting the real symptoms, but mild symptoms are there, and it is better to go and take the medical help as early as possible. And I would like to stress to today's youth that don't take it lightly. Because of our food habits, the unhealthy food habits which we are all consuming, we have a higher chance of diabetes, we have a higher chance of heart attacks. So it's always better to check your cholesterol once a year after the age of 20 or 25 if you have a family history of that, and then take necessary help, especially taking a diabetic cholesterol medicine and also correcting your diet at the earliest. So diabetes is becoming a biggest health burden to the country, to the society all over the world. It is bigger than AIDS. It is bigger than any tsunami which is coming to this human mankind. The complications of diabetes are the most dangerous. And as I said, when you get diabetes at a younger age, it is more dangerous. Younger age diabetes is considered a different diabetes than the previous diabetes. So the treatment of this younger diabetes is different from the treatment which was happening previously. Now, the cost of diabetes, managing these complications are huge, and it can cause huge burden. Like heart attacks, if you want to prevent that, doing angioplasties and stents, it is costing in lakhs. Like kidney failure, transplants, you have to do a transplant. In younger people are now going into the dialysis center so early in life, and that costs for transplants, kidney transplants, cost easily about 3-4 lakhs. Now, for a foot problem, like infections in the foot, it can cause huge cost to the family. It can cost about 3 to 5 to 10 lakhs. And the burden is huge. Now, with simple measures, we can prevent all this. Now, diabetes is called the mother of all diseases. Why? Because it affects all the organs, major organs of the body. And it is also considered the mother of all diseases. Now, if you go to any hospital, everywhere, every specialty, heart specialty, kidney specialty, leg specialty, everywhere it is because of the diabetes people are getting into these complications. By simple techniques, as I said, if you control the diabetes, control the pressures, control the cholesterols, you can prevent all these major complications.
Thank you, doctor. Thank you for sharing your valuable time with us. You can email your queries and suggestions at yourdiary@rosebowl@gmail.com.